So in terms of the deprescription, just going to give a quick overview here. But the main thing, first of all, I want to say a caution is to don't try this at home. So, we'll talk with showing those medication changes or reductions, but, this is something that really having medical supervision and guidance is really important for safety. And most importantly, in people who are on diabetes meds. And I've actually seen in my patients, people who started the diet on their own and were on medicines like insulin, and they actually had dangerous low blood sugars before they had that medical supervision. So it's something where you need someone to be watching, whether that's your primary care doc, endocrinologist, or others, to help make sure that you stay safe. A couple other points. So the glucose improvements can be rapid and pretty dramatic. So I will commonly see someone come in with blood glucose in the very poorly controlled range. So in the high 200s, 300s or beyond. And even in the first week of reducing their carbohydrates, they may see their glucose start to normalize or start to come into the 100s. And in order to keep them safe, we have to reduce the medications and particularly insulin. So in many cases, I may reduce someone's insulin by 50% as they start the dietary changes. And then over time, there's more fine tuning that goes into it to help keep the glucose normal. We don't want it to go too high and, of course, not too low. And then finally, again, that's avoiding hypoglycemia at all costs. This is something that we just hammer again and again with our patients and when I talk to folks, because it's a potentially deadly situation if someone's blood glucose drops too low. So it's something that we want to keep a really close eye on and intervene as needed. So, again, why do we deprescribe? I think I covered it in terms of from the safety perspective, but there are also other factors that I've seen that make it really important. And really because it makes both patients and providers feel like this. So I'll always want to use an excuse to use this GIF, but for a couple of reasons. So he's attacking cereal, and also because it is, I've found in my experience as a doc, it's been again and again the most rewarding where I get to tell someone to come off insulin, and our patients again and again just indicate that this is a life-changing time when they're able to stop a medicine that they thought they'd have to be on for life.
If you want to learn more about the science of epigenetics and nutrition longevity, check out my newsletter at Aronica.com and in the link below this video so you won't miss my upcoming free webinars, courses, and live Q&A.